Welcome to the first video in the Art of Medicine series. We're going to talk about discussing diagnosis and management of common conditions with parents in the emergency department. First up, mild to moderate croup without stridor at rest. So, croup can be pretty scary. I know that that's the reason that you came to the emergency department tonight. Usually kids will have a couple of days of congestion and cough, and many can have fever, and it seems like the kind of common cold you've likely dealt with before. But then, on the third day, you get what we got tonight. Now, I bet he woke up with a barky cough, and then he had that really scary, noisy breathing. And it was when he breathed in, right? And that noise can be accompanied by the skin sucking in above the clavicles or the collarbones. This is called retractions. And so that means that he was distressed. But what you noticed is that things improved when he calmed down. That's really important to remember with croup. So croup is caused by a number of different viruses, and chiefly it causes swelling and inflammation in the windpipe or the trachea. That leads to the barky cough because it involves the area around the vocal cords. And it can also cause that noisy breathing when you breathe in or inhale. Again, this is called stridor. Now, adults, the windpipe is really firm and rigid. You can feel it on your own. It's the cartilage, the rings of cartilage that give it its structure and shape. But in kids, that cartilage isn't as firm. You think about how much softer the nose or the ear or other parts of cartilage on a kid's body are. So when a kid is upset, that trachea, which in adults is a cylinder, well, in kids, it can collapse down a little bit. So you get that noise, so when they breathe in. Add to that, when a kid is upset, the resistance to air flowing in increases fourfold. Well, that's how you see that a child can be really distressed and noisy, but when they calm down, they can be pretty happy. Now, certainly, croup comes in waves, and we're bound to see several other cases tonight. In fact, the chief presenting time of day for croup is between 10 p.m. and 4 a.m. Now, we recognize that you have an adorable child, but we don't want to see him again. And this, I think, is the only part of the hospital where we can legitimately say that and mean it. So tonight, I want to give him a dose of dexamethasone. Now, dexamethasone is a steroid. It's a single dose, and it starts to work anywhere from 2 to 6 hours later. And what it's going to do is reduce some of that swelling inside the windpipe. Now, it's not going to give immediate symptomatic relief. It's not going to make the cough go away completely. But what it does do is reduces the risk of a return visit to the emergency department. Because most kids do have 2 bad nights with croup. And what usually happens is what you saw tonight. You're sleeping, you get in a deeper state of sleep, maybe some snot drains down the back of your throat. Kids cough, they wake themselves up, they become upset, and they develop that noisy breathing. The goal of dexamethasone is to reduce the significance of those episodes. But if you do see that he develops that noisy breathing again, do what you do best. Make him calm. I don't care if that means that you have to dance, juggle, sing opera, do whatever it takes to make them happy. Many kids will respond to cool air, so either going outside if it's cool or putting them near the freezer. Other kids like mist, from a humidifier or turning the shower on in the bathroom. Nevertheless, if you're able to get him calmed down and that noise disappears in a short time period, like 15 minutes or so, then you can feel pretty good about things. If he's got a fever, use Tylenol or ibuprofen. Certainly the fever is going to make a kid upset and may make the noise worse if they're crying and uncomfortable. Reasons to return? Well, if you see stridor at rest, that noise breathing in, skin sucking in above the collarbones, and especially if he looks blue or listless or doesn't interact with you. That's a medical emergency and I want you to come back. So remember, the dexamethasone, the steroid that we're about to give, it doesn't take the symptoms away, but hopefully it tamps them down and makes them less significant so that you won't need to come back to the emergency department.